So have you had any surgery done?
I have. I had a vaginoplasty in April as well.
Well, I can tell you for sure we would not have been able to see the third one. And if I did, you could just take my medical license right now. Hi, I am Shahram Salami. I am a plastic surgeon here in Seattle.
And what are you doing here today?
I am here trying to figure out who's had plastic surgery and who has not. Yeah, let's do it.
Hi, doctor. I'm John.
John, pleasure to meet you.
Nice to meet you.
All right. It'd be hard to tell just by looking at you if you've had anything done from a cosmetic
When you turn around.
No. Weird. Can you raise your eyebrows up? You've had some Botox?
Yep.
Okay, so I don't have any Botox. Watch when I raise my eyebrows, you see all these lines going across, right?
Yeah.
Okay, now raise your eyebrows. No lines. And you have good teeth. You've done something to whiten your teeth.
Bleach, yep.
Yeah. There's other operations like the chest and abdomen that you may or may not have had.
You want to ask him to take off his shirt?
I'm absolutely not going to ask him to do that because it's not a medical office and I feel extremely awkward doing that. Did I cover everything?
Covered pretty much everything. The only thing else that I've had is Kybella.
Yeah, so that's an injection to try to dissolve fat. Hurts like hell sometimes.
It does burn. All right, thank you.
That was good. All right, I'm calling that a win. Do I have a chair? Can I have a chair?
No.
I hate to talk down. Hi.
No, it's okay.
How are you?
You can talk
What's your
about
name?
Nikki.
Nikki, hi, Shahram. Are you comfortable talking about
Yeah.
the face? Okay, so what I do see is that you probably have what's called a facial nerve palsy. So other than that, I don't see anything else. Have you had any plastic surgery in the past? Tell me.
So I've had my breast augmentation done as well as a unimaxipexy.
Unilateral, one side lifted,
unilateral,
yeah.
thank you, yes.
Yeah.
And then I also had orthodontic jaw surgery to help create, because I couldn't even close my mouth correctly, and it has to do with, of course, this paralysis.
Yeah. Well, I think from the breast standpoint, I mean, it looks very natural and balanced with you, so that's great. That's usually a home run. Folks love that. Yeah.
Especially since I'm not wearing a bra.
A little more information than we needed,
I
but
know.
we're fine with that. Let's keep it going.
Oh, I'm proud.
Hi, Shahram. Nice to meet you. What do you do?
I take care of 4 kids.
Your children?
Yes.
You are busy. And you're wearing something very revealing, so it gives us a chance to kind of take a look. I'm just looking at your belly button. So if someone's had a tummy tuck, which is really common after having children, and certainly 4 kids, there's usually a little incision right around the tummy, right around the belly button. It doesn't look like you have that. I don't see that. So I would say you probably haven't had a full tummy tuck. And in terms of the breast, again, couldn't know for sure unless we, examined you in an office. I don't think you've had anything done to your belly. You may have had something done to your breast. So, have you had anything done?
Yes. I had a breast.
You had a lift or
Lift.
implant? Just a lift, yeah?
Yeah.
Yeah.
And they did tummy tuck and liposuction.
Well, good. Yeah, it's really common though. A lot of folks after having kids, something to the breast, something to the abdomen, and then different patients want more or less fullness in their bottoms.
Yes.
What's your name?
Anna.
Anna, hi.
Nice to meet you.
Shahram. Nice to meet you. Can I touch your nose? Okay. I'm just going to hold right here. For Caucasian rhinoplasty, usually we're taking away. Asian rhinoplasty, a lot of times we're adding. So the bridge is quite flat, so we're adding an implant. I was feeling to see if I could feel an implant in there, and it's hard to tell. I would say probably not. It's hard to tell. Have you had anything done?
Yes, but not on my face.
There you go. I can't just, what am I supposed to wear?
Well, I've had breast augmentation done and then I removed my implants. I like this body better than what I had before, and it was just not natural.
There are a lot of women who'll say, I did this and now I'm changing my mind, and it's totally fine to do that.
Do you have kids?
I do.
Any girls?
2.
Would you say, yes, go ahead and do it for your kids and your wife?
If anyone knows my wife, they know I don't get to tell her what to do. So she does whatever she wants. For my kids, it's difficult as a father because you look at your girls as perfect. But I think ultimately I would be supportive of them. It would just be difficult.
Well, thank you for what you do.
Hi.
Hi.
What's your name?
Haley.
Pleasure to meet you.
Nice to meet you. I'm nervous as fuck.
Why are you so nervous?
Plastic surgeons will read you, but they'll read you in like the nicest way.
Yeah, there's you don't need to, she's like 10 feet away from me. It's okay. The first thing I kind of notice is really symmetrical face. So if you take her face and then you draw a line right down the middle of the face, Okay? It's really, really symmetrical left to right. There's a lot of good things going on there. So I don't think you've had a rhinoplasty. I can't tell, but I don't think so. I think you're probably pretty much just kind of you. So have you had anything, any surgery done?
I have. So I've had my chest done.
Uh-huh.
That was fun. A slight Juvederm
Yeah.
Luma injection
Uh-huh.
done. And I also just had a vaginoplasty in April as well.
Well, I can tell you for sure we would not have been able to see the third one. And if I did, you could just take my medical license right now. Yeah, so, and that worked out well.
And that worked out. It gets wet, you can be orgasmic. I have a labiaplasty coming up.
A little more information we needed, but okay. Hi,
Hi.
what's your name?
I'm Rosa. Nice to meet you.
Nice to meet you, Rosa. You're very curvy, which is great. It would be foolish to speculate if you've had anything done to this part of your body. If I had to guess, I would say you've either had nothing done or you've had some removed.
Okay.
And then the rest of you, again, being so young, I would say it'd be surprising if you had any. I didn't ask if you had children, did I?
No, I never had.
Yeah,
I
so
don't have kids.
was I right? Was I wrong? Have you had anything
I
done?
haven't had anything done.
That's good. All right. I'm going to call that one also a win. I think I got it.
Okay, yeah.
Are you? You're dreading
Out
this?
of all the people, this is probably the most nervous one I've been.
You're most nervous? I'm making you the most nervous? How am
Yeah.
I making you most nervous?
I don't know, because you're a doctor. Doctors make me very
There's no
nervous.
knife? There's no needle? We're good, man. What's your name?
Davion.
Davion?
Yes.
Sharam. Well, you look like you're in great shape. Do you smoke?
Smoke what?
Nicotine.
No, I don't smoke.
I'm going to look at you from the side here a little bit. And then I'm just going behind your ears too. Yeah. Okay. So, I mean, your face looks great. I don't see any signs of having had an operation on your face. I don't think you've had anything done. I'm just going to go ahead and say it. I would be surprised.
I had a double mastectomy.
You did. Is everything going well with it?
Yeah, for
Yeah.
the most part, I'm just trying to regain feeling back. Probably not gonna get it back, but
How long has it been?
about a year and some change now.
Kind of coming to the point where you probably wouldn't.
Yeah, I'm not getting it
Yeah.
back.
That's okay. You feel confident in your t-shirts?
Yeah,
If you're swimming, do you feel confident?
yeah.
That's fantastic. Congratulations.
Thank you.
It's a big step.
Thank
You're
you.
gonna do great. You don't have to be nervous. Why you make me? I'm not. Do I make people nervous? What is this?
I think it's the amount of respect.
Yeah. That's, yeah, it's the uniform. This was not my idea, by the way. They sent me like 7 emails saying wear your scrubs. So I do t-shirt and jeans every day if I could.
Did anything surprise you?
When folks come and talk about, probably some difficult things that they've gone through. I'm always in constant awe of that because I don't think I could do that. That was great.